Hi, everyone. It's Alex Savidge at KTVU Fox 2 News in the San Francisco Bay Area. And as plans begin to form to roll out the COVID-19 vaccine, there are going to be a lot of logistical challenges for distribution. Joining us now to talk more about some of those issues is Dr. Sema Sagayar, co-founder and executive director of the Surgo Foundation. Dr. Sagayar, good to have you here today. Obviously, the vaccine is going to be in short supply early on, especially. So obviously, states and local governments are going to have to prioritize who will be getting those shots. Your nonprofit created something called the Vaccine Allocation Planner to help public health officials figure out who gets the shot and when. How is this going to work?
Thank you for having me, Alex. Absolutely. As you said, the vaccine will be in short supply, and a key part of this was going to be really planning and rolling out those short supply vaccines. So we developed the Vaccine Allocation Planner, an online tool with our partners at Ariadne Labs. And I do want to stress this is an open source, fully transparent tool where you can really see the back-end data. And essentially what this tool is aiming to do is empower decision makers at the state and county levels to really figure out how many doses they will need to vaccinate each priority population in the phased approach of vaccination. So for example, they can put in how many doses they're getting from the federal government and see specific numbers at their counties of how many people they can vaccinate in each group. So it's really meant to help them operationalize those national plans.
So you'll take data about what your high priority population is on the local level, whether it's the county or it's the state, and then you input how many doses you'll be getting from the federal government, and that what is the information that will come back from the planner?
Absolutely, yes. You'll put in how many doses you're getting from the federal government. You have options to select a single dose or a double dose vaccine. As we know, most of the vaccines that are being approved are double dose vaccines. And then you can select the priority group that you want to vaccinate at the state level. And what the tool will tell you is what percentage of that population you will be able to vaccinate in each county in your state. There's other things you can do with this tool. You can actually decide to put aside 10% for emergency use. You can decide to prioritize certain counties, perhaps because the pandemic is a hotspot for the pandemic or it's a more vulnerable county. So it really allows you to test different scenarios that you are interested in terms of rolling out your vaccines.
From what I understand, part of the goal with a tool like yours is to make sure that underserved communities don't get passed over for the when it comes to the vaccine, that it's not just well-to-do folks and folks with means who are able to get their hands on the vaccine in the long run here. How does a tool like this help to sort of level the playing field?
Yeah, thank you, Alex. That's such an important point. As we know, COVID has had a disproportionate impact on communities of color, on communities depending on the types of jobs they do or their age or their underlying comorbidities. So what this planner really allows you to do is really select those characteristics of the communities that you want to prioritize, both at an individual level, but also in terms of a county level. So as I mentioned, if a county, for example, is overwhelmingly vulnerable to the negative impacts of COVID, and we know that there are certain geographies like that in the United States, you can actually help bring those counties up the line so that those counties get the vaccine sooner than other communities. So it really allows you to ensure that the most disadvantaged, the most affected are the communities and the jurisdictions that are getting vaccinated first.
All right. Obviously, local governments, they're going to have to prepare for the unexpected, right? I mean, there are going to be uncertainties. Things are not going to go necessarily according to plan. What are some of the biggest factors that you think cities and counties and states should prepare for when it comes to distributing the vaccine?
Yeah, I mean, the rollout of the COVID vaccine is really an unprecedented, I would say, public health intervention that this country had to, implement in a very long time, because this is not only about getting vaccines out, this is also ensuring very high levels of vaccination in a very short period of time if we want to achieve that herd immunity that we collectively want to achieve. So there are extremely challenging, I would say logistical challenges that, states and counties face, all the way from not even just the vaccines, but the syringes and all of the supplementary material that they have to, bring together to be able to vaccinate. How are they going to distribute this to the points of vaccination, whether those are the pharmacies or the health clinics or other community centers? Who are going to be the personnel that are going to be vaccinating? How are they going to have that, workforce being able to do that? And I think another really important part of this puzzle is also, are people going to be willing to accept this vaccine and get vaccinated, and what kind of barriers, whether it's hesitancy barriers or whether it's access. Certain communities may have a hard time accessing these places. So I think there's a lot of challenges ahead of us that we need to collectively really nail out.
Absolutely. Do you know at this point how many local municipalities are using your vaccine allocation planner, or are planning to use it here in the near future, as hopefully in the coming weeks here, the vaccine begins to be distributed?
Mm-hmm. Yeah, so we rolled out this tool a few weeks ago, so it's relatively new, and we are already working with a few health departments, state health departments across the country, in terms of the value of this tool and what kind of data it's providing. And so definitely we are in that process. I do also mention that there is another tool, which is called Tiberius, which is by the federal government, that also certain states are using. But the value of our tool, that it is fully transparent, and so that you can really interrogate the back-end data and the methodology. And so we also have health departments that are using and comparing both tools.
Oh, interesting. Yeah, that seems like a good way to go. Where does where does all the data that you're using for the system come from?
Yes, so the data all comes from very well sourced, validated sources of data, actually from the federal government and from states. So these are data sources that are national, that are very high in quality. So there's many data sources that we had to bring together, but also do statistical analyses and calculations to be able to develop some of those county level estimates. Again, all of this is fully transparent, fully available on our website. So anyone who's interested can go and find all of the sources and the methodology.
And just to be clear here, this is really more a tool for local governments, because obviously a lot of folks out there, the big overarching question right now is, where am I in that vaccine line? I mean, how long might it be before I'm eligible to get these shots here? This is not a tool that the average person like myself would necessarily be able to use to answer that question.
This is not a tool where you could go in and input your individual data points and figure out when is your turn. Yes, this is really a tool for decision makers, but there are other tools out there that are more simple for people to get a sense of when they might be in line to be vaccinated.
Why was this the mission that your nonprofit wanted to dive into here in the midst of this pandemic? I mean, why did you begin to think that this is something you wanted to develop?
Well, we have been working actually on the COVID agenda since the very beginning, since early March, and this is one of several tools that we have put out in the United States. We actually started with developing a very granular COVID community vulnerability index, which is now being used by a lot of organizations, as well as State Department, health departments within the states. And that was really to understand the negative impact of COVID in different communities. Along with that, we've been analyzing a lot of data and again, supporting organizations in this response. So this is one of the many things we are doing in the COVID response, and we're very committed to the COVID response, and we'll continue putting out other tools and other insights.
Well, it's going to be certainly, it seems like a key part of rolling out this vaccine and doing it in a fair way, and a way that gets people vaccinated as soon as possible here. I appreciate your time and laying it all out. It's called the Vaccine Allocation Planner, and it was created by the folks at the Surgo Foundation, among others here. And I appreciate you taking the time. Dr. Sema Sagayar is the co-founder and executive director of the Surgo Foundation, a nonprofit based in Washington, D.C. Appreciate you taking the time today. Thanks so much.